So I really enjoyed interacting with all the patients and keeping their spirits up in such a difficult time. It was really rewarding to keep them in touch with their families, and you could see how much their families appreciated keeping in constant contact every day. We also made sure that the patients had little things like a daily newspaper, word searches, teas and coffees, things like that. I think it was these little things that kept everyone's spirits up really, and got them through the day really. So that was really nice and really rewarding. So the biggest challenge was really communicating with all the PP on. So we quickly adapted to doing like waves and thumbs up and things like that, and I think that really helped the patients. And you know, some of them were really hard of hearing, so it was quite difficult, so we just had to go a bit closer to them and just try the best we could to communicate effectively with them. So now that I've come back into the world of dentistry, it's really helped me, and I've brought all the experiences from the Nightingale back into the dental practice. It's helped me communicate with lots of different patients more effectively, and you know, use non-verbal communication more. I guess we're still all in the PPE, so it was a good experience. So yeah, I definitely recommend that trainees go into different work streams. I think it's good to do a different role in patient care, and then also bring those experiences back to dentistry. So I definitely recommend, you know, going out of your comfort zone and going into a different work stream.
I'm Neil, I'm a foundation dentist, and my role during the pandemic was to help with the Greater Manchester Urgent Dental Call Service. It's been a really interesting role, and it's been very variable. It's been a great learning experience, dealing with a different patient base from potentially what we'd see in practice. Patients that typically do not have dentists and are very high needs. It can be quite intense, certainly. It's 4 hours of non-stop calls, and with the patient base typically being patients that are in pain, they can be quite aggressive as a result, being quite distressed, and sometimes you feel like they're taking it out on you. But it was something that you get well supported through. Certainly with the fast-paced nature, the team were really supportive and encouraging you to just take it at your own pace, take it with what you're comfortable with. It's been a really good thing to do in terms of my development. It's really been a big benefit in terms of my ability to communicate with patients, because without being able to see them face to face, you're a lot more reliant on that ability to sort of ask the correct questions and sort of listen out correctly for the responses. So it's been really helpful in terms of history and diagnosis, making sort of quick assessments and trying to come up with plans that suit patients fairly quickly with quite limited information sometimes. In addition, it's been a really good tool for improving my prescribing skills, so making correct calls to appropriately diagnose and appropriately prescribe. Yeah, definitely would recommend. It's been really interesting, and it's been a really eye-opening experience that's been really good for developing skills that I might have not otherwise been able to home in on as much.
I enjoyed the patient interaction and feeling part of a wider team, and I also enjoyed learning about more frail and elderly patients who you may not regularly see in practice, and previously I could have been worried about treating. I found it quite difficult to adapt to the surroundings and establish everybody's position. I think this is a problem generally in the hospital due to initial lack of communication. However, it was also mostly down to the fact it was a startup hospital. This opportunity has greatly improved my communication, as well as helped me further understand some complex medical conditions which can affect elderly patients. It has also helped me recognise that as dentists, we are part of a wider healthcare team, and how speaking to general medical practitioners and other medical individuals can really help further our care for some patients. I would recommend to embrace the experience. You will gain additional skills with patients that you might not normally see in practice. Don't fret about not knowing things. Everyone understands you and you, and it will come with time.
So I'm a foundation dentist who was redeployed to Greater Manchester Urgent Dental Care Phone Triaging Service. So this was a role where I saw a wide group of diverse patients who had not been in contact with NHS dental services very often. Often it meant that patients we had no prior record of, no charting or radiographs. Due to the fact that these patients had not accessed dental care before, often they had very high dental needs and presented with quite serious, severe problems, things that can be life-threatening. Patients presented with symptoms for sepsis. So this was the biggest challenge, often getting them to sort of seek the help that they needed remotely was difficult. It meant that we had to chase up hospitals, A&E admissions, just to try and make sure that they had access to the care that they'd been advised to. This gave me an experience of thorough history taking. It gave me a history of pain management, of diagnosing pain, assessing conditions and prioritising patients. So for this role, communication was paramount. Even though it was remote, it in fact made communication more important. Communication had to be clear, effective. I had to constantly sort of check that patients understood what I meant, but also that they were understanding me and sort of my advice.
My role during the pandemic was I was redeployed to a COVID ward in Arrowe Park Hospital. I really enjoyed the experience as I haven't managed inpatients before, so it was an excellent experience to gain a number of new skills, including cannulation and venipuncture. I enjoyed being part of a large ward team and felt I was a valued member. My biggest challenge was discussing and breaking bad news to patients' families over the phone. I feel much more confident in managing inpatients, which will be beneficial to future posts. I have a broader knowledge of a number of medical conditions and the management of these, and a better insight into blood interpretation and reading chest x-rays. Is to use this as an experience to develop new skills that will help in the future.